Oxygen delivery, part 4. A practical application for increasing oxygen delivery. The study of medicine and surgery looks at an entire process. The process can be oxygen delivery, or cardiac pumping, or muscular movement, or structural support from bones or cartilage, or nervous integration. But it is a process that is important to understand. Once the normal process is understood, the physician or researcher tries to figure out what interventions can be taken along the steps of the process to improve the quality of life for the patients we serve. These interventions are the treatments. Traditional treatments like basic wound care and dressings for open wounds, or surgical intervention to establish an airway in someone in respiratory distress, and newer interventions which are occurring on a molecular level all have a place in the future of medicine and surgery. It is an exciting field to be in. With that said, let's return to the practical applications of oxygen delivery. In part 3, it was noted that oxygen dissolved in the solution of blood is not enough to support a patient at rest. The equation was CaO2 equals 1.3 times hemoglobin times SaO2 plus 0.03 times the PaO2 divided by 100 milliliters. The first part of this equation related the amount of oxygen carried in hemoglobin, and the second part of the equation was the amount of oxygen dissolved in solution. At atmospheric pressure, 1 atmosphere or 760 millimeters of mercury pressure, the amount of oxygen dissolved is not enough to support life at rest. However, if the pressure is increased 2- or 3-fold, the amount of oxygen dissolved in solution is increased. This was Henry's law mentioned in lesson 1 of oxygen delivery. It has been shown that at 3 atmospheres of pressure, approximately 2,280 millimeters of mercury pressure, or like diving below the ocean at a distance of approximately 100 feet, can increase oxygen dissolved in the blood. This has practical applications. It is a field of medicine called hyperbaric medicine. It is important for some types of wounds and medical conditions. Hyperbaric oxygen is simply abbreviated HBO. There is a very interesting paper published in 1960. The reference is on the video. This is an original paper, and it presented original research from the Department of Surgery at the University of Amsterdam. The researchers were trying to study how long the heart could be clamped off. In the 1960s, this was important information to determine. Heart surgery was in its infancy. The use of hypothermia on the metabolism of warm-blooded animals, in this case pigs, demonstrated that below a certain temperature, 27 degrees centigrade, some changes were not tolerated. However, using oxygen at 3 atmospheres allowed the clamping of vessels for longer periods of time. In fact, the researchers were able to replace blood with a solution similar to Ringer's solution. The oxygen was dissolved in solution when it was available for the heart. The researchers looked for changes on the EKG to determine what effects were on the heart. The surgical team performed the experimental surgery in a hyperbaric chamber. It is interesting reading from the perspective of the 21st century. Oxygen delivery is a process that can be effected at many stages. If a wound is lacking oxygen, then HBO can be considered. If oxygen delivery is due to heart failure, then improved cardiac output can be addressed. If decreased oxygen delivery is due to blockage of the blood flow for any reason, then correct the blood flow. Determine what needs to be done begins with the history and physical examination and proceeds. Thank you.